Medicare Part D has had some major changes due to the passage of the Inflation Reduction Act. These changes include a cap on your out-of-pocket drug spending, and they include requirements for Part D plans and drug manufacturers to pay a greater share of the cost for Part D enrollees who have high drug costs. It will also mark the end of the Part D coverage gap, also known as the donut hole. The stages of Medicare Part D will work the same whether your Part D is standalone or built into a Medicare Advantage plan. Let's walk through the basic structure of Part D plans in 2024 and beyond. Although Medicare Part D plans are offered by private insurance carriers, each plan must meet minimum federal guidelines and follow the structure of the standard Medicare Part D model. Part D drug plans currently have 4 stages, and Medicare sets the limit for these stages each and every year. Insurance carriers can offer benefits that are richer than the basic model, and when they do, they call this an enhanced plan. Most carriers offer enhanced plans. The 4 stages of Part D are the deductible, the initial coverage level, the coverage gap or donut hole, and catastrophic coverage. Let's start with discussing the deductible. The deductible is the amount that you pay out of pocket first each year on your medications before your co-pays kick in under your plan. Medicare sets the maximum deductible each year, and Part D insurance companies must keep their plan deductible at or below that number. In 2024, the maximum deductible allowed is $545. Part D plans can waive that deductible or set a lower deductible for their plan, but they can't charge a higher deductible. Many plans tend to stick with whatever highest deductible is allowed by Medicare each year, and I think we'll see more plans charging that full deductible now that the Inflation Reduction Act is capping the maximum out-of-pocket that you will pay for Part D drugs. More on that in just a moment. First, let's examine how the deductible works. If your plan has a $545 deductible, you will pay 100% of those costs for your covered medications up until you have spent that much and satisfied that deductible. For example, if you have a medication that costs $100 when you go to the pharmacy, you will pay $100. Then you will only have $445 left to spend on your medications before you fulfill the deductible and move on to stage 2, the initial coverage level, at which point the insurance company starts contributing to the cost of your medications. It's important to remember that a plan with a lower than standard deductible or no deductible isn't necessarily the one that will be the most cost effective for you. Sometimes you may find a plan waives the deductible, but it will have higher copays or higher premiums than another plan with a full $545 deductible. In my experience, you'll spend that money one way or the other, either in an upfront deductible or tacked onto the copays that you spend throughout the year. Here's a tip: if you take mostly inexpensive generic medications, look for plans that apply that deductible only to the higher drug tiers. On these plans, you might be able to get your Tier 1 or Tier 1 and 2 medications from day one for just a regular copay with no deductible applied. This way, you only incur the deductible if you have drugs that fall into those higher tiers, which are usually for brand name or specialty drugs or for some of the more expensive generics. Each plan gets to determine which tier it will place its covered drugs into, and during stage 2 of your Part D plan, you'll pay either a flat copay for those medications or a percentage of the cost of those medications, called a coinsurance, based on which tier each medication falls into. During this second stage, called the initial coverage level, the standard basic Part D model has enrollees paying 25% of the total drug cost and Part D plans paying 75% of total drug costs up to $5,030. During this stage, however, many Part D plans will charge a mixture of copays or coinsurance rather than the standard 25%. Your share will be based on which tier the drug falls into. Insurance companies create a formulary for each plan, which is a list of drugs that are covered by the plan. These drugs are usually broken into 5 tiers: preferred generic, non-preferred generic, preferred brand, non-preferred brand, and specialty medications. Each tier will have a copay or co-insurance associated with it. And sometimes you'll see a sixth tier, which on many plans is for insulins that the plan covers, which by law will have a flat copay of $35. Typically, the first tier will include many preferred generic drugs that have the lowest copays, and the fifth tier, which is often for expensive specialty drugs, will have the highest copays or co-insurance. For example, you might find a drug plan that has a $5 copay for preferred generics, a $10 copay for non-preferred generics, a $40 copay for preferred brand name drugs, and so on. The copay or co-insurance amount listed for each tier is what you'll pay for your medications in that tier when you pick them up at the pharmacy or get them from mail order. Now, as you are filling these medications, Medicare is tallying your total drug spending, including both what you pay and what the plan pays for these medications. If the total drug spending goes over a certain limit each year, which is 50/30 in 2024, you will fall into stage 3, which is called the coverage gap. Let's look at an example of how your costs might change once you reach the gap, at least for calendar year 2024, before the coverage gap technically disappears in 2025. Say you have a plan where one of your tier 3 brand name meds costs $400 retail and your copay for tier 3 meds is $60. During your initial coverage level, you'll pay that $60 copay for that medication. However, when you reach the coverage gap, many plans will switch to charging you the full 25% of the cost of that medication. This means that when you hit the gap, you would go from spending $60 to $100 for that particular drug while you're in the gap. Sometimes you will see little to no increase when you get into the gap. And I've even seen where the cost of certain drugs goes down in the gap because of how the percentages will work. Just know that if you have some expensive brand name medications, you may pay as much as 25% of the cost of those covered drugs in stage 3. The biggest change to Part D for 2024 pertains to stage 4, which is your catastrophic coverage. This is the stage that kicks in to protect you from catastrophic medical spending on your medications. Prior to now, when you reach the catastrophic coverage, your Part D carrier paid about 95% of the cost of all your medications for the remainder of the year, but you were still responsible for up to 5%. The Inflation Reduction Act eliminates your share, so that 5% goes away. So in 2024, all Part D drug plans will have a hard cap when you reach $8,000 in total drug costs. This amount includes what you pay out of pocket plus the value of the manufacturer discounts on brand name drugs in the gap. And in 2025, it will get even better when legislation will limit annual spending on covered Part D drugs to $2,000 per year. This amount will be indexed to increase each year after 2025 at the rate of growth in per capita Part D drug costs. Essentially, this provision eliminates the coverage gap, and Part D enrollees will no longer face any changes in cost sharing for a drug when they move from the initial coverage stage to the gap stage, which of course is very welcome news. Furthermore, beneficiaries who have trouble making a big expenditure on certain drugs will be able to opt into a program that lets them space out their share of the costs over the course of the calendar year. We expect more details sometime in 2024 on how that will work. Now you may be asking, what is going to happen to the Part D premiums when your potential spending falls from $8,000 cap to a $2,000 cap? What we have seen so far this year is approximately a 20% increase in the overall average premiums for Part D drug plans in 2024 across the United States, and I suspect we will see additional premium increases next year. The Inflation Reduction Act limits increases in the base premium to no more than 6% above the prior year. However, it doesn't limit increases in the supplemental Part D premiums that make up a significant share of what you may pay. So it will be interesting to see what happens with premiums next fall. In 2024, we've had an interesting twist While many plans had big increases, there was at least one insurance company that went the other direction, radically dropping premiums, probably to get as many people into their plans as possible. Remember, the premiums that you pay make up only a tiny portion of the revenue that plans get for offering Part D. They also receive significant funding from Medicare. If all of this sounds confusing and you wonder how in the world to choose a drug plan, the good news is that you can get free help with Part D whenever you have a Medigap or Medicare Advantage plan through us here at Boomer Benefits. We'll run the analysis and help you select a plan each year that makes the most sense so that you can choose wisely. And when we help you enroll, we'll become your agent. This will give you access to free support from us on the back end when all of these things are changing and are likely to bring up questions for you. Thanks for watching, and we'll see you in the next video.